Good morning. It's wonderful to see everyone. You can't see me standing here, I know, because of my height, so I'm going to stay here. How's the sound? It's working well? Okay, good. Well, I am really honored to have been invited by John and the Institute for Health Economics in Alberta. I have been hearing about John for many years in terms of the incredible leadership and contribution he is making, not just in Alberta, but across the country. I am the kind of person, since I was young, who has only ever been comfortable in the space in between. What an ironic kind of thing to say when I care so much about working in health and well-being. Because our health and care systems aren't designed to be connected in the space in between. And most often, many of us have to go to heroic efforts to make that happen. No matter our lens, no matter our role, living in a community, working in a community, leading policy, research, organizations across the full continuum of health and care and across sectors. 30 years ago, when I was a clinician, I started working with older adults and their families. And I worked in a multi-level health system supporting older adults and their families in Canada, in Ontario. And I was struck by, no matter how many people I was working with, no matter their lived experience, no matter where they were originally born or where they are now, individual people and their families were going to heroic efforts to make a system work for them that wasn't designed to be connected. And I made a commitment to myself that instead of feeling like an outsider, because I was only comfortable in the space in between, I was going to facilitate and navigate and connect up the spaces in between. A little bit about what led me to be in the position that I'm in today, which I hope is a voice and a support for positive change that actually closes the gap between what we say we want and what we're actually able to do and deliver together, and how supporting each individual, each organization, each sector, and every government in our country to maximize our full potential together. And so the conversation I want to have today is a little bit about my own journey, but most importantly, about my journey that has led to so much connection internationally, nationally, and within provinces and territories that may bring light or information that may be helpful. In 2008, I started on a journey in Ontario where I had accountability for integrating care for people, older adults who had complex care needs, children with medical complexity who may or may not be dependent on technology, and people who were living towards end of life. And the ambition was, how might we understand what's most important for people in Ontario, and how might we connect up health and social care to work together and focus on what's most important to them? That led to some of the outcomes in Toronto, in Ontario, that led to reaching the quintuple aim, which may or may not be familiar, which we'll spend a minute on in a second. And it ended up being highlighted as receiving provincial medals for the top quality around patient safety in Ontario over a number of years, and national practices across the country. And what I learned, and I remember hearing when Barack Obama was asked, what do you wish you did different after your first year in office? And he said, I wish I would have looked up and looked out. Head down all the time doing the work, but wait a sec, there's so many resources and people and knowledge available to us. And that's when I came across the International Foundation for Integrated Care. Hands up if that's familiar to you. Okay, good. So let me tell you about the role I serve today. I serve as Vice Chair for the International Foundation for Integrated Care, which works with over 100 countries and close to 200,000 people across the world that are have a policy lever to advance integrated care within their communities or their countries. I also, through that work, helped co-found with Dr. Walter Watchus at the University of Toronto at the Dalai Lama School of Public Health, our North American Center for Integrated Care, which includes the Network for Integrated Care Excellence, which was funded by the Canadian Institute for Health Research to serve as the collective impact hub in Canada for all the integrated care work happening. Not only what the Canadian Institute for Health Research funds for integrated care, but other efforts on integrated care so that we can learn together, unlearn together, grow, and have impact together. I also serve as co-director for the Health Leadership Academy at McMaster, which is helping create our first National Health Fellows in Canada to lead collectively across provinces and territories and across the full continuum of care, including private and public, and including people with lived experience and caregivers as partners in our leadership model for the country. I serve a role advancing large-scale change with the Institute for Healthcare Improvement, and I decided to do all this through my own platform. Because you can imagine sometimes when you're in one organization, we work very hard to honor the needs of that organization. How many of us have the opportunity to work across all? And I always ask that of ourselves, no matter our organization, no matter our platform, how might we think about how we achieve our greatest ambitions in our provinces, in our territories, and in our nation? And the answer, and it's in the evidence, is by building it together. Now, that's not an unfamiliar term. I walked around and had an opportunity, I'd say, to meet 60% of the people in the room before we started today. And I know we have people that have held the most senior roles possible in the room and currently are. And I know we have people that are just starting out their careers and care very much around the future role they're going to have. And when we think about that, we have a moral, ethical accountability to think about health and well-being in our local communities, in our provinces, our territories, and across our country. And this is true whether we're talking about it in a neighborhood or one-on-one interaction, when we're thinking about it at a provincial or a regional level, and then we're thinking about it from the entire system level. So what I want to share to you today transcends all, and I come at it from a complex adaptive lens. So let's get into it. The Institute for Health Improvement has identified 5 indicators that help us understand the extent to which are we being successful in meeting our aims. Are we bringing value for money? The experience and outcomes with people in their family, are they improving? What about the extent to which we have joy and support in the work we do for those of us that work in health and care? And is care equitable? Is it accessible? Have we created a sense of belonging across every person that lives in our communities? And the answer is this is possible, and there are areas that have demonstrated success on all 5 domains. But we have variability across the world, and we have variability because of the how, not the what. What we want to achieve is common. How we get there has so much variability when we look around the world. And in preparing for today with John, with Ray, with Jesse, we said, well, what is some of the evidence or the models that can be levers or help us? I don't know if the rainbow model is familiar to you. I won't spend much time on it, but it's an incredible resource because it looks at integrated care, both from creating the enabling conditions, but also at the micro, the macro, the meso, and the macro levels. And what do we need in place to help enable this? Where there are 9 pillars for integrated care that are evidence-based, and there's literature, and I've put some of the links here, and all this will be available, that there are 9 elements that help us ensure we are meeting the quality dimensions that Jessie talked about, and that Jessie's work that she shared today is very much aligned to, the Institute for Healthcare Improvement, 5 areas of quality, and the standards around integrated care and population health. But let's take a minute and look at those 9 elements. 3 are foundational, fundamental. What's our purpose? Do we have a shared purpose? Are people partners in care? Is this a top-down solution, or is this something that has been co-created and together we feel that this is exactly focused on what is most important to people and their families and honors what we need to achieve in our health system and on the cycles in which we have to show performance? What about how our system and our governance is designed? Do we have the right governance models that aren't set up for governance sake, but are governance models that enable the change and the conditions and have the levers to achieve these goals? The enablers are, how might we think about our aligned payment systems? What about supporting people, our workforce, and our capacity? What are the digital solutions that help us with breakthrough that we could never otherwise achieve? And then when we think at an outcome perspective, are we being transparent? Do we know what we're measuring? Can we share our results? Do we understand how to use it in a way that helps with the learning health system approach, learning and leaning forward, sometimes failing and moving forward, so that we can build resilient communities and achieve health and well-being? Now, Jessie shared a definition of integrated care. I think it's important to recognize that definitions of integrated care are relevant while we're in government and we think about our policy, when we're in organization or sector leadership, whether in the private or public sector, and when we're in communities or at the point of care. And I find this slide incredibly, incredibly helpful, and you'll let me know if you feel the same. When we think about integrated care, very often we are looking at an integrated clinical pathway. So perhaps somebody needs hip or knee surgery, and there's a clinical pathway from a family physician or a nurse practitioner in the community into a hospital where we have an intervention or a surgery, and then we come home. And we're being supported perhaps by home care and our family physician or nurse practitioner. The integrated clinical pathway is quite simple if you look at it from an integrated point of view. And many provinces, like Ontario and Ontario health teams, are advancing integrated clinical pathways. They're critically important. There's something you can show results, especially within election cycles where you want to show the value of integrated care and the difference it makes. But what's really important to keep in mind is all the integrated pathways in the world are not going to help us achieve health and well-being at a population level. And so while we're advancing integrated clinical pathways, our head is turned to our possible future around health and well-being. How might those clinical pathways serve as ways for people to start working together or to show the value of integration while we're also working to support, this is not a kind of human word in terms of kindness, but segments of populations. We hear about this all the time. How do you look at our whole population and look at a segment? Older adults with complex needs who are living over time to have full and healthy lives. What might integration look like? All the way until we get to an entire population or at a community level. As you go up, we are more adaptive. As you go up, you can't have a clinical pathway. It's adaptive. It's principle-based. The number of collaborations increases. The governance models have different levers. And so what we've learned time and time again, no matter the jurisdiction in the world, there are 2 pieces that we have an opportunity to build our strength in while we advance policies that go deep in one area and connect across. Do we understand our ambition, and what are the enabling conditions? And I like to frame it as, How do we pattern our possible future? And Bill Sharp's work in this area is pretty profound. I will look at my timer sometimes if you see me walk away. I want to make sure I stay on time. He talks about, in the first horizon, what are we doing to reinforce our status quo? And how might we be patterning a possible new future that is the counterforce to the status quo? And if we look at the research on how systems change, I very much appreciate the research that comes out of the Collective Impact Lab, that the largest barriers to health system change are also the greatest opportunities, because they look at the deeper conditions. And as John said with me today, the difference between being a florist or a gardener. The gardener looks at the deeper conditions. The florist is taking what looks kind of above the ground and perhaps relocating it, which is great. Maybe we'll make a vase and a bouquet. What an amazing opportunity to do something beautiful. And how might we consider the conditions? If you're familiar with Deborah Rowland's work, doing this gets a 52% increase in impact for large-scale change. And the work we are talking about around integrated care and population health, we have an opportunity to look at it from a large-scale change perspective. And when we do that, there are seismic shifts in how we think and we behave. There's seismic shifts in how we look at the resources we have sitting in front of us. How might we consider not just our organization mission, but what is our shared purpose across all of us? And how might we align our organization efforts to work together? How might we think about all the incredible organizations we have in our communities and our provinces who are reporting on their own performance dashboards? And how might we say, what's a common one that we could collectively tell our impact story? How might we move to consider all the abundance we have within our organizations, across all our people, to bring us about in our communities, in our provinces, in our country? Radical collaboration is the operating model for large-scale change. And what's so interesting about it is it's not the soft skill, and it's not what you do at the side of your desk. It is the fundamental mode of operating. Every person, every day. And at the heart of it, what it allows for, backed by the research, is not only are we coming together to understand our shared aspiration, we're learning together, and more importantly, unlearning together, so we can grow and have systemic insights that allow us to take action at a scale that we may not have been to ever before. And there's a lot of signals around the way the world is going, and there's a lot of resources. So let's just quickly look at a couple. Is the NUCA health system familiar? South Central? John, others? Okay. Well, NUCA has some of the best outcomes in the world around the quintuple aim. I know it's really small, and you'll be able to read it after. But those that were working in government and in organizations recognized that they were not having the outcomes that they had hoped with the policies and the levers that they had. They actually relinquished the dollars to the community members and said, okay, you set the priorities, you tell us what's important, and we'll design the system with you. They do have some of the best outcomes in the world. And of course, you can't take that model and supplant it somewhere else, because context is so important. But there's something in it that's very powerful. The second is, did you see NHS announcement around their priorities last week? Well, we know the NHS moved to integrated care systems, and this is the next iteration, which is neighborhood models. But the piece that I find really important around the signal is we are building an NHS fit for the future, one that fits around people's lives and is integral as part of their community. Neighborhood health services fundamentally reimagine bringing care closer to home while helping tackle our nation's shameful health inequalities. Now, I don't mention it around the blame game. I mention it because the bravery to name what we might have to do differently, which takes us to Scotland, who worked with people that live in Scotland and work in Scotland and set out 9 health and well-being goals for the country. 9. Through the lens of people in their families and those that work in health and care that honor what government needs to achieve, identified the outcomes that were going to be measured, and you may ask by whom? Integrated care boards. So in every neighborhood and community, an integrated care board was put in place. The goal was the 9 health and well-being goals set by the Scottish government, put out by the Scottish government, we're holding each of those groups to accountability for and sharing the outcomes transparently, and served as a rule to say, what are the enablers or what are the barriers that help us get there, and how might we help you achieve those goals? And Ray is going to share an example and go into how might we achieve something like this. And of course, we're all thinking about what is the opportunity sitting in Alberta right now. We brought the International Foundation for Integrated Care Conference to Alberta in October. Many of you were there. I'm so excited about it. And one of the reasons we did that is because some of the best innovation in our country is sitting right in your province. Some of the best innovation around community-led health and well-being. And some of the intellectual capital you have in your province is so outstanding. And some of the colleagues that are closest to the international movement are here in Alberta. So while we're going deep in areas, which is so important and so brave and so needed, how do we also make sure we have the connective tissue across? Together makes progress. I saw yesterday, I don't know if you're familiar with Georgina Black. She's the head of growth internationally for Deloitte. Deloitte just made a commitment to the world to tackle some of the biggest issues through this tagline. Together makes progress. How might we convene for the answers? And I was kind of going through a walk of my relationships and what I know of Alberta, which is still growing all the time, and this is for demonstration purposes. But the strength and assets you have in your community and in your province are mind-blowing. I think about your approach to asset-based community development. I think about the Imagine Citizen Network through Judy Birdsell and the work with Health Quality Alberta that has set out 9, not 9, but health and well-being goals. I think about the Institute. I think about all the areas that you're here representing and the incredible assets you have. I think about Health Standards Organization and the maturity framework they have for integrated care and primary care. How might we be using and connecting these resources to help us? So with my final few moments, I'd like to share some of the resources that are available to all of us. The first is the International Foundation for Integrated Care, where I serve as vice chair and play a role helping represent Canada at an international body. The foundation itself is a not-for-profit organization, but its intention is to help create a movement and share the evidence, advance the knowledge, support capability development, support international collaborations, and grow the movement. If you're not familiar, it has the largest factor-rated journal on integrated care with all the evidence, the International Journal for Integrated Care, runs academies, but we convene every year. We hold an international conference. Many of you have been there. The next one's taking place in Birmingham in April. So we have about 147 countries involved. And what's what's important about that, it is one of the only communities where we democratize the experience and the change process. Policymakers alongside people with lived experience, alongside clinicians, alongside organizational leaders or sector leaders, alongside private and public. One community. We try and dispel or break through the tension that often happens when we're wearing a particular hat, and we try and bring us together in shared purpose. There are many hubs around the country, and I happen to facilitate with Walter Watchus the North American hub. Now, I think it's a really incredible opportunity for us because our intention is to learn and connect up what we're all doing so we can learn from each other, grow, and have impact together, which includes the Network for Integrated Care Excellence that I had told you about. And this is the approach that I find that is the biggest breakthrough. And it's aligned to everything I shared up front about large-scale change, micro, meso, macro. The approach is around collective impact. We help serve as a backbone to share the evidence, the knowledge, to create the community, to help people feel and be part of something that's bigger than the individual piece we're working on, even though the individual piece we are working on is so important. And what's ironic around integrated care, and I've walked around the room and I heard this too, is wait a sec, I don't even know some of the integrated care efforts that are happening in our own communities. What's ironic is while we're doing this work, back to lifting up and looking out, we don't always know who else is doing what. And sometimes we're starting from scratch unnecessarily. And so the whole goal is to connect us up and share knowledge, knowledge products and tools, and you can be connected to it. We have learning communities. We have research and evidence. We work with teams directly. Anything that would be helpful. In Canada, we have 10,000 people who are engaged. Again, across every part of health and social care, if you care about health and well-being in our country. And why I was especially excited to come, just 2 weeks ago, we held a virtual community, which anyone can sign up for, free for everyone. We usually have a mix of every role in the health system across our entire country. We showcased 3 people in Alberta. Because some of those people, like Shauna McGowan, like Helen Lightfoot, like Richard Lewinchuk, are doing work around connecting people in communities around health and well-being. And some of the best examples in Canada are in our backyard. And so we're working with the Canadian Institute for Health Research to share knowledge and to learn around what our opportunities are. This is what's sitting in front of us. All of this is available to all of you and anyone in our country at any time. And here's a couple things that are coming up. The first is we launched a newsletter that gives all this information to everybody that you can access, and it's in the material that will be in here for you. We are launching the first national case studies on integrated care that will join the international case studies on integrated care. But what's different about the case studies that will be launched in Canada, they will be the first in the world that identify where people with lived experience and their families are partners, a part of designing the solution. And then we are holding the next North American conference on integrated care in Ontario. And so my final piece is consider how these resources may be of useful, how we might be able to have a conversation that may be useful around not only leveraging the resources, but how we think about a health system using the quality dimensions, knowing that integration is every person, every day. Thank you so much.